is planning on joining us, and I know that Ms. Eisel is planning on joining us, so we'll let them jump in when they get here. But we'll start with introductions. Start by the back there.
Jane Taylor, Housing and Neighborhood Services.
Betty Washington, Action NC.
Jenny Busby, Action NC.
Allison Preston, the Livian, formerly Charlotte Housing Group.
Roberta Whitner, City Real Estate.
Dave Farnham, Fire Strategic Planning.
Bonnie Devine, Mecklenburg County.
Lacey Williams, Housing and Neighborhood Services.
Alice O'Corn, City Manager's Office.
Kelly High Foster, CMPD. Pamela Wiseman, Housing and Neighborhood Services.
Paul Pascal, CMPD.
Kurt Putney, CMPD.
Chief.
General Smith, CMPD.
Sarah Hazel, City Manager's Office.
Gibby Harris, Public Health.
Rebecca Hefner, Innovation and Technology.
Sean Kaufman, Charlotte Water.
Willie Ratchford, Community Relations.
Angela Charles, City Manager's Office.
Mark Eggleston, Chair.
James Mitchell, Vice Chair.
Renee Johnson, Committee Member.
Victoria Watlington, Committee Member.
Braxton Winston, Council Member at Large.
Bernarda Miller, Community Relations.
And Jeremy Mills, Office of Constituent Services Communications.
So last month we started on the path of creating this framework that we've been charged to create by the mayor, and given 60 days to do so. If it's the will of the committee today, staff is going to present to us after Ms. Harris presents to us the county community violence overview and plan. Staff will present the proposed violence reduction framework based on the conversation we had last month. Accept any suggestions or friendly amendments to that. If the committee is prepared to do so, we can take a vote on that today and fulfill that charge from the mayor to create that framework and send it up to council. If for some reason we're not, we can discuss that towards the end of the meeting. And depending on what action we do or don't take today, might influence when our next meeting is going to be. That was one of the ones you'll recall on our calendar. We'd said that we would tentatively we would potentially move that meeting date from our normal monthly date on account of the primary election, which I know one of our committee members will be very busy during, and
Yes.
many of us will have several obligations for. So I'd like to welcome the mayor, Mayor Pro Tem, and the Kay Cunningham.
Okay, Cunningham.
Not even paying attention.
DK, oh.
So with that, we'll let Ms. Charles kind of frame our discussion and introduce our first guest.
Sure. Thank you, Chairman Eggleston and Vice Chair Mitchell and members of the committee and also council members. Today we have an exciting agenda. We will first begin with Ms. Harris, and she will be giving an overview of their violence plan.
Good afternoon,
Afternoon. Good afternoon.
Mr. Chairman. Well, the mayor just left the room. Committee members, thank you for the opportunity to talk to y'all about the plan that we've been working on and the direction that we're having in conversation with the county commissioners. I'll start by saying the hope is that we will continue, and I do say continue, to work with the city and our other partners on moving this effort forward. The charge from the county commissioners was really to focus on okay, there it is. Okay. To take a public health approach to looking at the issue of violence. And so I don't take for granted that people understand what a public health approach is. I think we have lots of different definitions for that, but I would like to just speak just briefly about that. There are a number of different steps to a public health approach. The first is really taking a look at the data, making sure that we understand what the issues are, and using that as a framework for helping us make decisions about how to move forward. And looking at the data really helps understand what the root causes of the issue are, whether that is a disease that we're working on or whether it's a situation in the community such as violence. The third is really looking to engage and involve our community in the solution space around those root causes. So understanding that our community quite often has the solutions. They understand what their needs are, and if we do not engage them and involve them in the development of planning, we quite often miss the mark. The other thing to mention about a public health approach is that it's comprehensive. It looks at things broadly. It does not look for and I've avoided using a specific term when I talk about violence, but there are no simple answers. It's a very complicated issue. And the third is that if we are going to impact the issues that need to be impacted when we're looking at an issue as broad and as entrenched in our community as violence, we have to look at it from a sustainability standpoint. It's not a quick fix. It's not something that we can get done in even 5-10 years. It's ongoing, and we need to treat it as such. So I took out, for the county commissioners, I put some data in. Y'all have seen the data. I didn't want to go back through that again because I think we already sort of understand what the issues are. But I did want to talk about addressing this from a community perspective and a public health perspective. So when we look at community violence, it's pervasive, right? It's persistent and it's complex. There are lots of socioeconomic issues that impact the issue of violence in our communities. And it requires a multidisciplinary approach. It is not, again, a quick fix. So when I look at a public health community violence prevention plan, I look at a plan that addresses the root causes of violence. And I want to point out here that when we look at the root causes of violence, those are the root causes of poverty. Those are the root causes of chronic diseases. Those are they're the same root causes. They just impact our communities in different ways. And this plan has to, as I mentioned before, be comprehensive, collaborative, and sustainable. So I don't know how many of you have seen this pyramid before. We use it in public health in lots of different ways. But the bottom line here is that it takes all the different layers. We have to address all of those issues if we're really going to have the impact on violence in the community that we want to. But I would not be a good public health professional if I did not address the fact that primary prevention, which will impact the majority of people in our community, will have the biggest bang for the buck. The challenge is that biggest bang takes a long time. It is not a quick fix, and that's why we tend to not be as successful with prevention efforts as we would like to see us be, because it takes time. But obviously, suppression is part of the answer. We have to make sure that we are doing the suppression that's necessary in our community, and we're doing it in an effective manner. But then there's other issues in between that we'll speak to here briefly. So again, number one, we want to make sure that we're looking at this broadly. Number two, that we are being very careful about the things that we are choosing to implement, and that they are specific to the needs of our community. What works in one community doesn't always work in another. That doesn't mean we can't take what those communities have learned and tweak those things to meet the needs here, but that we do need to make sure that the local circumstances are taken into account. Institutional strengthening, and that happens across the board, whether that's at the community level, where we're building the capacity of our community to address some of these issues, or whether we're looking all the way up to the city and county level and needing to make sure that we have what we need in place to do this. And evaluation is key. To implement things and to move forward without evaluating and tweaking as we need is a mistake as well. So we did some research on what other communities are doing across the country, and what we found is that these are effective components of plans in communities. Organizational structure. There has to be someone who gets up every morning and it's their job to think about this and to keep these efforts moving forward. That does not mean that that entity, that individual is implementing all of these things, but they're making sure that it's all connected and that it is continuing to be comprehensive and moving in the same direction. Targeted services for high-risk youth, and we base that on the data. What high-risk youth in one community might be different than another based on what we're seeing in terms of the data. A violence interrupter program of some point, community mobilization, clergy involvement. The faith community has been very instrumental in other communities in affecting violence in their community. Enforcement strategies, and then looking at these workers in our community that are actually in the community, embedded in the community, and doing that work, working with individuals. So we've had a work group that has met several times to try to put together a beginning framework. And I'll say beginning because if you look at a public health approach, it's not unusual for it to take a year to put a full plan together. If you are going to seriously engage the community in the process, it takes time, and it takes effort to make sure that we are hearing all the voices we need to hear and that they're having input into the plan. But at the same time, we recognize the situation that we have in this community and that we need to move some things forward. So we brought this group together to have some conversation about where we could start, recognizing that there's more work that needs to happen after that. In addition to this group, there's been consultation with the superintendent from the school system and from other community-based organizations and faith-based organizations. So this is what we came up with as a starting place, and I again emphasize starting place. again, leadership for a comprehensive effort. And back up to that leadership group, or that group that's been meeting, the overlay of that and what has come from the conversations is meetings of the city manager, county manager, the mayor's been involved, as well as the chair of our board, to look at how we move this forward in a concerted way. As I mentioned earlier, it's not always important on who's implementing what parts of the plan, but there's got to be a way of looking at this together to make sure that we're all moving in the right direction and that we're implementing that comprehensive plan. So there needs to be some type of leadership in place. We have that high-level leadership. The city and the county manager have been meeting. We're in the process of setting up regular monthly meetings to make sure that we're all staying on the same page. And those meetings will involve the sheriff and the chief and staff who are helping move this forward. But there's got to be at least one person who is on top of this on a daily basis, whose job it is to stay engaged and involved. And we're having conversations about what that looks like. The community engagement piece, again, I've mentioned that several times. That is a piece that has not happened yet. That's got to be a major part of what we do moving forward. And engagement with the community has to be purposeful. So it's not just a matter of pulling people together to hear what they have to say. We have to have a purpose. What are we trying to accomplish? What are we trying to get out of those conversations? It has to be strategic, and it has to be solution-based. You have to hear from the community what their concerns and issues are, but we really need to focus on, so what are the solutions to that? What are the needs? What are we moving forward? And those meetings have to be we have to have individuals who know how to facilitate those meetings in a way to make them productive. There have been several meetings that have happened over the last months where people have been brought together, and it has turned into the loudest voice being heard, and others who need to be heard not being heard. And part of that is because they've not been well facilitated, and there's not been a purpose outlined in the beginning for the meeting. So that really needs to be part of this moving forward. The second is looking at our communities and our neighborhoods and the infrastructure in those neighborhoods, building that capacity in a way that allows them to be part of the solution and to implement things in their community. So that might be giving some of our community-based organizations and others who are doing this work resources, helping build their capacity, but letting them take the lead and giving them the power to do that work. We have looked at an emergency department intervention program. There are several models that are evidence-based out there in the country that have proven to be very effective. We have our level 1 trauma center here in this community, and what they're seeing is up to 25 to 40% of the individuals who come in from a violent situation, whether it's perpetrators or victims, 25 to 40% of those come back again with another violent situation that they found themselves in. But the problem is right now all the emergency rooms are doing is patching them up and sending them back out to the situations they're currently in. So this is one of the things that we've been looking at. An interrupter program, Cure Violence, has been thrown around a lot. It is a model that's out there in this country. It's worked well in some places. It's not worked well in others. And a lot of the conversation that I've had with community as well as with the partners that we're talking about is that we need an interrupter program, but we need one that works for Mecklenburg County. And what does that need to look like? How do we take the components of that plan and make it work for us? Our sheriff has actually talked about some jail reentry strategies. Our criminal justice programs at the county level focus a lot on people coming back from prisons. The folks in our jails are not there long, typically, but they're still coming back out into the same situations that put them in the jail in the first place. So what type of efforts do we need to implement there? Other options that have not been fully discussed that really have to be included in this are looking at potential policy changes and the enforcement strategies. And obviously, our sheriff and our chief and the DA have been talking about what those look like and how those need to be incorporated in the bigger plan.
Ms. Harris,
Yes.
in your recommendation for around the leadership, that top bullet point, this presentation, I assume, was initially crafted as a recommendation to the county commission. Is that Mecklenburg County saying that Mecklenburg County needs to have somebody who every day they wake up and their main focus is this work, and that we would be mirroring that at the city? I mean, that each of the main stakeholders in this, that kind of work group that you had up there earlier, that somebody in every one of those departments should be waking up every day with this being their main focus.
I believe that's true. I think there needs to be somebody in every area that has that has this on their plate. But in addition to that, I think there needs to be some effort that is pulling all of that together. I mean, what we're seeing now is, I'll give an example. How many different entities in this community provide some type of case management or care coordination? And how many of those are providing those services in those communities? If you look at the hot spots that were identified by the city, how many of those are providing services in those areas? And how many of those actually talk to each other, know what each other are doing, leveraging the resources that they're doing, and putting what they do best overlay on that situation with that family? There's got to be an entity that's making sure that we're all talking together, that we're all working together, and that we're moving that plan forward together. Otherwise, we've got the city with their person who's focused on their efforts. We've got the county with their person focused on their efforts, the hospital doing the same, sheriff's department doing the same, police department doing the same, school system doing the same, and we're not moving the dime. We've all been doing that. We've all been trying to make efforts and looking at how we work together. And so I think when I was asked about a public health approach, my perspective on this is that's a community approach. That is not an individual entity approach. It's not a city-county approach. It's how do we, as a community, come together and figure out who's best to do these different pieces. Because, obviously, I run the public health department. I am not looking to create programs around violence in the public health department. We are not experts in the area of violence. What we do is we convene, we coordinate, we help move efforts forward. That's my main goal here. I would look to the chief around suppression and the expert and looking at what's happening out there and what we can do better around that, how we support that. That is my role. It's not to create programs. Our criminal justice program does a better job of creating programs around violence. They have the expertise to do that. Y'all do work in the communities already, building capacity in the community. How do we support that? How do we build on it? And how do we make sure that not others are doing little bits and pieces of that around what y'all are already doing, but how do we pull that together? So I think it's a both and.
Mayor.
In the research that Gibby and Rebecca have done, there's often an office of violence prevention or something, which I think is really kind of a tough thing to be in charge of, the Office of Violence Prevention. But I guess, I'm sorry, Dr. Harris.
No, you call me Gibby, please.
No,
not formal.
One of the things that I wonder if leadership actually changes and builds upon these other efforts happening, because before you have leadership that can plan and do this kind of work, but if we have the community engagement and the neighborhood initiatives and some of these other things, leadership has to come from what programming you have so that you choose the right person that's a bridge between community and what you're doing. So I think, while leadership is always at the top because you need someone thinking about it every day, I'm wondering, as leadership changes on occasion, what's required of it and how we do it changes based upon the more of the community engagement, some of the infrastructure development issues. So it's interesting. I think until you have, for me, I need to have a little bit understanding of how in the planning phase you do all of these things to choose the right leader for the sustainable effort, which is different than the creation effort.
Ms. Wallington?
And as I think about this, this feels like a multi-work stream program, right? And so to your point, somebody's got to be the program manager, but then you got work stream leaders in each area, and then exactly what the mayor just described. Has there been any thought yet as to who these, and I'll call them work stream leaders, would be in these areas, because they may be running that particular strategic plan for that single effort versus at different times during the stages?
Oops. So this might help a little bit. All of it hasn't been identified. And I did not put suppression and I did not put policy up here. Those are things that probably need to be added to this. Mayor, I appreciate your comments. I think there's different levels of leadership too. So there needs to be some staffing support to do the planning and to do the community engagement and involvement, and it's got to be the right people to do that. The first step, I did have a conversation with Manager Diorio yesterday a little bit about just having somebody that can do some project management around this to get it moving as a place to start without actually jumping into leadership right away, but having somebody that can help move it forward. But the thought was, obviously the hospital one, Atrium Health would be the leader on that. But a lot of this is community-based, and so how do we find those community? And part of that would be, my suggestion would be with some of these things we start with pilot. We don't go, we've got to figure out what an interrupter program looks like. And it could be a little bit of trial and error in the beginning. Some of the community development work that we talked about, you'd probably need to figure out which communities you wanted to start with, which neighborhoods. What we talked about at the county commissioners meetings were the 4 hotspots that y'all had. Maybe we start with 2 of those because those seem to be areas that have particular need. The community engagement piece needs to be broad, but there's definitely some areas that need more of it than others to begin with. Some of it wouldn't get implemented right away.
Right.
I think this would take place over time. But there's opportunity there if we have some staffing support, maybe support to begin with rather than leadership, just to make sure that we're moving this forward and we're having those conversations we need to. The engagement of the community is critical. It is a critical next step that we need to get started, and we need people that are trusted in the community that can really facilitate these conversations well.
Mr. Winston, and then Mayor Lyles.
Forgive me if I'm minimalizing this, but don't we already know who these leaders are, who these folks are in the community? CMPD already spends millions of dollars on community programs, on folks that are helping. Our micro grant program, we've identified people that are doing things in the community. Those are the folks that are on the ground level right now, that have prescriptions. As it was said, these root causes of violence, or the root causes of poverty, or the root causes of these chronic illnesses, that people have been doing work on the neighborhood level for generations, but have not been able to get that support to pull it out from underneath just a CMPD budget, but to get this institutional support. So the way I see it is that we know these folks, so the outreach has been happening. So the idea that we have to start again would be a non-starter in the community. We need to this person to maybe push the county and the city and Novant and whoever else to say to really ramp up these resources. But the idea that we have to start over, I would push away from.
I appreciate that. I don't think that was not my intent. I've had the opportunity to have conversations with a number of organizations that are doing this work already. The question is, how do we, having the opportunity for them to come to the table, because they haven't yet, and be part of the discussion and helping us figure out how to move that forward
They've
and
been
what they
banging
need.
at the table, but we haven't allowed them at the table.
Exactly.
Over time.
So a lot of what we're looking at here, especially with the community neighborhood work, is a shift in power and some significant resources that can help support those organizations, but also making sure that we're providing the capacity building for them that can help them grow, because the last thing we want to do is set them up for failure. That won't help anybody. So it is multi-level focus. And, the other part of that is, I've heard from some individuals in the community say, we know what to do, just give us the money and let us go do it. And yeah, I'd agree with that to a point. But there's always got to be, so what are you doing with it, and how are you going to show us that you're being successful? That's always got to be part of the equation as well. It's not just a giving out money, because I'm not sure that that's helpful either.
Got Ms. Lyles and Ms. Watlington, and I do want to allow you to finish your presentation. I started
okay.
it, so I started the sidetrack, so I apologize.
That's okay. We're already towards the end of it anyway. So.
I want to follow up. To me, if these are sustainability, when we're not at this table, there has to be some agreement and principles that we've all accepted and codified in a way that makes a difference. And I think Dr. Harris has pointed out, for example, we do have a lot of people working in this, but we don't know who's not working. And most of the new engagement models start talking about engaging people in different ways so they feel like they can be a part of the participation. I think especially an agreement on what engagement means and what the model is important to sustainability. I also want to say that there's a lot of strength in every step. And how many of these are we going to be able to start as a project manager and have the most impact? Because, again, when we're not sitting around the table and someone says 3 years from now, well, why are you doing this? There has to be something that documents that and that push for the institutional part. And I guess one of the things that I worry about in the neighborhood model, I think we said this last night at our meeting, there are many people in this community that have gone through reentry, and it's easy for those that are very active to come out and participate. But I don't know that we've really engaged everyone or asked them if they are willing to be engaged to go through this violence reduction and interrupter model. We had an interrupter model in this community. I don't know if you're familiar with Dr. Harris, on pregnancy. And the community rejected it fully because we hadn't taken the time to talk about this engagement model and what would happen. And after a year, it was like, no, done on teenage pregnancy. And it didn't happen because there was no real effort around sustainability and assessment.
And I think that speaks to the need to be planful around this. When you have something that's right in front of you like this, you have a tendency to want to jump and start things right away. But if we're not careful, we end up with situations like that. We just need to make sure that we've considered all the things that we need to.
Ms. Wellington?
Yeah, and that was going to be my point as a watch out before we get down the execution path and start making decisions at a granular level. We need to make sure we've got the holistic scope understood and the success criteria, and even from a cost standpoint, what do we think that this order of magnitude is going to take and where are we going to get it from, so we can really talk about what we can realistically do. Because that rigor and execution, I think, is the piece that's going to enable sustainability. Because there's so many parts and players, we got to make sure that we know where do we go look to understand what's the status of the work, who's involved, and everything that you guys have already said. But plus one to proper planning on the front end.
So we'll let you get back in the presentation. Sorry for
No, that's
veering you
okay.
off.
I think we may have already taken care of most of it. Community engagement, you can define it in lots of different ways, but, it really needs to include all of these issues. And there, like I said, there are some who are already starting to do convening. Action NC had one event. They've got another one that they're planning in February. Actually, it's already February, isn't it? The question is, how do we make sure that as we're going out and convening the community around this, that we're being comprehensive about this and connected, so that we're not having pockets of conversation that don't link back to helping drive. The community neighborhood infrastructure development pilot, what we talked about with this is a number of different components. If we went into a neighborhood, and I say we, that's the proverbial we, looking at community education, actually having some individuals in the community that are engaged and involved in a way to provide leadership and support, through the funding that we talked about, after-school programming, the things that our kids need in the community, but also these are multi-generational issues. If we're not addressing family stability, if we're not addressing mobility programs for families, we're missing the boat there as well. Some of you may have heard about the RECAST grant that we have. It's a SAMHSA grant that's focused on trauma and resilience in communities, and we have an RFP out right now to work with some what we're calling faith-based hubs. We have churches in the Crescent who are seeing people from their communities every day, coming through their doors, who have been traumatized in one way or the other, and who are needing resources. What I'm hearing from the pastors is, we don't know what to do with them. Most of the time. We don't know are there resources where we can refer them. I'm getting text messages. I've got somebody who's in mental health and substance abuse crisis right now. What do I do with them? So what we're hoping with these hubs is that we can do training with pastors and others in their churches around trauma and resilience so that they better understand the impact of trauma on an individual and can address that more appropriately when they see them, but also funding navigators in a couple of churches that can actually do that connection to service and do follow-up with individuals. Even when these pastors are seeing that people, they find a place for them to go, they refer them, they never get there. There's no one to follow up to make sure, do you need transportation? Can I encourage you? Can I go with you? What do you need? So we're not sure exactly how many, but a handful of those as a pilot to start and see how that works. And then the whole issue of economic development. In a lot of the communities where we're seeing a lot of violence, there are fast food restaurants, there are sort of these storefronts that don't stay long, that really don't support their community and aren't engaged and involved in their community, and sometimes are places where things congregate that aren't helpful. So the idea there was what can be done from an economic development standpoint to not funding for those restaurants, but to develop some economic I'm losing the word that I want, but to help them be more of a community member and support their communities. So sort of a package of things that can be done in community, and there's probably more, but these were just some of the additional things that were talked about I've already talked about this program. What they would do is have people in the ER who would help connect folks to services, make sure that they've got the emotional and social support that they need when they leave the hospital. But again, this is an example of we could have the hospitals go out into communities and create their own services that they want, or we can connect to services that are already in the community and the folks that are already providing services. So that's the need, is that let's make sure that this is all connected. Y'all have probably heard enough about an interrupter pilot, but just thinking about what that might look like and engaging the right people and figuring out how to implement something like that. But it really focuses on sort of interrupting potential violent crimes. So these would be individuals that are in the community that have been trained and are connected to resources for those folks that are most likely to implement a crime in a community. And then the jail reentry I talked about a bit. What's happening is because these folks are not in that system very long, they get put back out before resources can be developed for them. So how do we make sure that those resources are available once they get back out in the community and help them be a little more successful? So, that's really high level, and there's a whole lot more planning that goes with this. I will tell you that the one thing that I've not specifically talked about is there's a lot of healing that needs to go on in this community, and a lot of that has to do with engagement, involvement of the community around some of the issues that have happened over the years here to help move us forward. So that's part of that community engagement piece, is giving people a voice and letting them be part of the solution. And the last thing I'll mention is that I've had a great experience working with your staff on this, and I'm hoping with the next presentation that you'll see that we're linked up in a lot of ways in terms of how we're thinking about this and moving forward. And having the city manager and the county manager working together on this, I think, is a step in the right direction to help us move some of this work forward. So,
Wonderful. Thank you. And then Ms. Ajmera has a question.
Yes, thank you, Mr. Chairman. For the Emergency Department Intervention Program, Dr. Harris, under the leadership, I see that we have Atrium Health. Have you also looked at comprehensive set of healthcare providers in the region, whether it's Navant Healthcare and others? Because I see that we are looking at the plan from a high-level perspective, where we are trying to touch as many people as we can, and healthcare plays an important role in that. So having multiple partners in this effort would also help us touch a lot of lives.
I appreciate that. I will tell you, we do have another initiative that's happening through the Mental Health Task Force as well as through the Recast Grant, where we are working with a national organization that's doing training and development with a number of different entities in our community to help them become trauma-informed providers, which is different than just being able to do counseling. And Novant is one of the lead entities there. They're doing some great work and are implementing that through 6 different hospitals within their system. So I do think that there's opportunity. The main reason we're talking with Atrium is because they're our trauma center in this area, and they're seeing. I'm so sorry. I thought I had turned that off. Crickets might be appropriate. Another phone. I apologize.
How many phones do you have?
Two.
Oh, that's not too
Two's
bad.
enough. Yes, and so I do think there's more opportunity to engage the medical community in this conversation, and hopefully have them become part of the solution as well.
Ms. Issel and then Ms. Johnson.
Thank you, Mr. Chair.
Dr. Harris, I do, well, two questions. Is there another model besides Cure Violence that you've seen nationally that is something to have a look at?
I've not seen another one that's considered evidence-based at this point. There are a number of communities that have taken the Cure Violence model, the components of it, and determined what would work best in their community, and they just have not had a chance to evaluate that work as thoroughly as Cure Violence has. But there are other models that are being implemented that we could look to, and the components that are in those plans. The challenge we have with Cure Violence, if I look at it, is that there has to be, in the places where it's been effective, there has been a very strong community-based organization that's very involved with the population of folks coming through Reentry that can then implement the project. In the communities where it's not been effective and has, in many cases, just been suspended, there has not been that strong community-based organization, and the fallout from the people that have been brought in to do the interruption has been almost negative in some situations. Okay. So again, and I'm hearing this from community as well as from some other partners, is making sure that whatever model we implement is something that's going to work in Mecklenburg, and that we've got the right organizations involved in that, and that we're providing the right supports around that.
And that's a great point, which led to my other question question about the permanency here, because I think we struggle as a community to do anything permanently that involves city, county schools. So we've got that to start off with.
Yep.
And secondly, in this particular case, you really, sort of the acute problem is violence prevention or interruption, but the chronic problem is how do we deal with resiliency and how do we deal with trauma? And so I don't know how you do that without some kind of a permanent structure that is bought into this from all of those bodies and says we're going to keep doing this work even when the numbers all of a sudden look good. Because we've seen this over the decades here, that when violent crime goes down, nobody talks about it anymore. And so all these great task force that had great recommendations all get shelved. So, because nobody owns it, really.
And I couldn't agree with you more. The ownership is key, but the ownership has to be across the community. One of the ways to make it sustainable is to change the structures that have created the environments that we see. And if we don't do that, it doesn't matter whether we have an office forever and ever, it's not going to have the long-term impact that we want it to have. We'll see ebbs and flows maybe, but so that there are structures in place that have created the situations that cause the trauma and that are causing the root causes, and we've really got to address those.
Thank you for your work.
Got Ms. Johnson and then Mr. Winston, and I want to make sure by 1 o'clock we get to city staff to present this proposed framework, because I think we're going to have a lot of feedback and questions on that as well. Ms. Johnson.
Dr. Harris, this is such a wonderful presentation. I mean, just your approach when you talked about changing the structures and shifting the power and trauma-informed and grassroots and solution-focused. This is just a great plan, and I hope that we can work with the county to implement it, because these are strategic and practical answers. So thank you.
Thank you.
Mr. Winston?
I'm hoping for the same thing.
Yeah.
So one thing, if we may kind of like think about the way we're thinking about this, I kind of disagree with the Mayor Pro Tem about this idea of a permanent body, because the idea is that we shouldn't have a permanent body, right? If we fix these solutions, these programs and these efforts should become obsolete at some point in time. And if we just look to create something that a structure around this problem that is always going to persist, well, then you admit defeat. in the end, and you create markets that profit off of these ills of our society. What I see here is kind of us taking those top 3 levels of the pyramid on slide number 3. And in slide number 7, I think a reason for this is we have at the very bottom of slide 7 is potential policy changes that have not been fully discussed. When we as elected bodies really should be working, as continues to be told to me over and over again since I've been in here for over 2 years, that we should be working on the highest level possible, that we have to look at these policy changes that are going to institutionally change the systems that create this. So when are we going to be presented with these policy changes that are going to change the entire paradigm of the system that allows these things to persist? Because until we do that, we're just having good conversations for the front page of the paper to say we do something. Am I thinking incorrectly there?
I don't think you are. I think that, I put that piece about policy changes on there specifically knowing that we have not had conversations about that in that group so far. And part of the presentation last week and the presentation to y'all today is having our elected officials provide some direction on moving things forward. And so if y'all are ready for some recommendations on policy changes, then we need to put together some policy changes, work with the city and the county to bring those forward. And I think there's some work happening between the city and county and the elected officials and having conversations about what kind of joint policy changes could be brought forward. So here's an opportunity.
I one vote for that.
Well, we appreciate it.
Thank you for the opportunity.
Absolutely. Thank you. And we'll welcome up Ms. Hazel and Ms. Hefner to present the proposed violence reduction framework that we started on last month.
And let me ask this, do you have the framework in front of you, or do you need it?
This was really like the county.
Yeah.
Yeah.
So I don't understand.
I think they're actually the same things we should be doing.
What I have for you guys today to think about is a framework based on the conversation that you had during the last meeting and building off of our conversation at the January strategy session. So what this document is an opportunity to provide some guidance around these key building blocks that will then support staff in a couple of ways, help us get some direction around some immediate actions, but then also will inform this ongoing conversation through the budget process. So what we're hoping to do with this document, if this is indeed the right document, is to solidify some good direction that will then influence our next steps and be translated into the budget through that process this year and in future years. And in addition to that, I'll say that that's also important that we are having these conversations and having them with our partners as they're going through those same processes around the same time. So you'll see that a lot of what's in here is similar or complementary to what Dr. Harris presented. So what I'll do is I'll just kind of walk through some key highlights, and then you can take it from there. So if you go to page 2, you'll see the 5 key building blocks for this framework. Based on the conversation that you had at the last meeting, we added intergovernmental collaboration as a key component. And then we took these 5 building blocks and identified some short-term and long-term goals related to each building block and further defined what those building blocks meant. So if you go to page 3.
Scroll down one.
Yeah. Thanks. under intergovernmental collaboration. So a key piece of this was ensuring that there's collaboration not only between city staff at the staff level, the city staff leadership level, but also the elected level, but defining what that will look like. So if you look at our short-term goals, sharing information, I think hopefully we had a good opportunity to demonstrate that we're working on that today during this meeting. Identifying areas for potential joint legislative action. I think to your point, Councilmember Winston, that could be a short-term goal. And then a couple of things that highlight from long-term goals, really participating in a community-wide planning process. And if it is your desire to provide opportunities not only for this group to meet, but for cross-collaboration between not just staff, but elected bodies in some capacity that reinforces and supports the work that we're doing around these issues. So I'll just keep walking through unless somebody wants to pause and talk about one. Community collaboration and priority areas. So this key building block is all about how we layer our own programs, focusing on the priority areas or hotspots that were discussed in the January meeting. How are we layering our existing programs in those geographically specific areas to provide maximum impact? How are we working with our partners to do the same thing? And so in the short term, we would want to make sure that we're being very focused around who's participating in those conversations, making sure that we're being thoughtful in community participation in those conversations, and exploring to commit to some action teams for folks who were a part of some of the efforts over the years. We've had some success doing that in specific geographies where we're harnessing the power of all of our city departments and the type of services they provide in a geographic area, and bringing in also other partners to the table to think about what are those immediate actions that can see some quick impact. But then in the longer term, identifying some more strategic improvements, infrastructure, housing, leveraging those types of things.
Mayor Lawson.
In this area, this is, I think, one of the most important priorities that has to be figured out. As Dr. Harris said, this community needs a lot of healing from things that have gone on. We've had lots of efforts around this idea of community engagement, but there is new research being done on community engagement around this area specifically. I think that while we have explore and commit to participation in community action teams, that to me seems to be an outcome versus an agreement on how to do something. And I would like for us to not go quickly to that step. I know the partners are there, but I think we have to have an agreement on what is community engagement. What does it mean? And how will we sustain it? This needs to be something that's 5 years of budget financing, and it's built into what we're doing. And I don't know that we've actually had a conversation about what is the citizens' agreed upon way to be engaged with us. We talk about us way too much on this one. This has got to be more about the community. I think I've seen some models that are around, but they have to be decided upon by people that own it. And so I'm just a little bit concerned about the specificity of this without a discussion of what we currently do and what are the models that are working. So just my thinking on that.
And then I won't jump ahead, but that's valuable feedback. When we get to investing in community-led efforts, you might have similar thoughts. So I won't talk on page 4 too much about the interrupt violence model. I think Dr. Harris did a good job describing that. But this is just to point out, this is based on the research that was done. You know, this is a gap. We should be exploring a pilot around this and support that exploration and then that execution when the time comes. And so this is both about how to move that forward and making sure that we know what our role can be to help in that, whether it's lead, support, what have you, and then identifying a way to sustain that work. Investing in community-led efforts, this is core, and core to ensuring that folks who have been doing work and building capacity in neighborhoods for years are supported, lifted up, and are at the table throughout this conversation. And this is obviously a conversation about racial equity and about equity. So in the short term, we talked a little bit at the meeting previous about our microgrants. That's a good example of a community-led way that we support community-led initiatives to address violence. How are we leveraging those in our priority areas? How are we thinking about building upon that work in the short term, since that's an existing program that we already have? And then in the long term, how are we doing more and investing in community leaders? And they may not be new community leaders, they may be new to us or in our work. And so that is why this is a key component that needs to be highlighted.
I want to ask another question on this one. We started the Jumpstart Community Micro Grant Program, and it wasn't about violence. It was about building community, and it wasn't about hot spots and all of that. I guess I want the council to discuss and determine whether or not we continue to do that and we do something else around what we're going to do with providing that investment in community. I just feel like, are we substituting something because it's easy and we've got it already done? Or should we be creating something, continuing this? And I don't want people to feel like they got a Jumpstart grant and now they're related to violence.
Sure.
I think we ought to have a program that Jumpstart is here and you can still apply for it. You continue to do what you're doing, because those were good community efforts that we invested in. But I guess the question is, if you're going to do something around violence prevention, would you want to just automatically make that Jumpstart versus something that we are actually going to add and address that's evidence-based and community focused? I think our Jumpstart was around the idea that people are doing good work and we ought to support them.
Yeah.
And we didn't say it had to be evidence-based. We looked at it and we supported them. If we're going to do violence, I think it ought to be around programs that are evidence-based and have the idea that it's community-focused as our criteria. I think two programs are important and that they shouldn't be commingled. That's just, I think council would discuss how it works and whether or not they think they should be commingled or not.
Mr. Winston?
Never mind.
Never mind.
And so, to your point, exploring what additional citywide programs might look like that focus on this topic, and then really leveraging the resources through partners. I mean, it's kind of like a broken record, I'm sure, on every page, but that has to be a key component of our long-term efforts. And so finally, on the last page, this is all really grounded in using data and evidence. And so one key building block is going to be that not only do we continue to ramp up our efforts to share data within our own departments and break down some of those silos, but how are we doing that across agencies and with our partners in the community? And so to that end, establishing a measurement framework and how we're going to report back and to who, including to City Council, is critical. Identifying the programs that we want to assess that we are not currently assessing, to understand how they are being successful or what could be tweaked or changed about those programs so that they can be more successful in this framework. And then I'll highlight the other piece, which is Rebecca has been leading, which is convening an interagency group to really think about the key research questions, what data is needed to help support this overall effort. And then longer term, who do we need to bring in to help with this evaluation once some of these things are underway, and what does that ongoing process look like? So I'll stop there for your thoughts and more feedback.
We got any questions? Yes, sir.
Thank you, Mr. Chair. So, Sarah, if I can, let me just make a couple points. I think on the community collaboration priority areas, I do think in one bullet point, short term, we highlight Charlotte Mecklenburg schools, but I do think they need to be able to the city and the county as we talk about a true collaboration effort, because the kids we're going to identify probably a large percentage come from CMS, so I do think we need them at the table as a partner. The mayor touched on the micro grants, and I have to thank Mayor Pro Tem when she first rolled this out. I was very skeptical of the effectiveness of the program, but the mayor is right. To me, it was about community, getting them involved. So I don't mind if we want to change that focus and make them evidence-based, because I think some of them can show you how many young men they have reached, the changes they have made, because I know a couple of organizations I think have done a great job taking that grant and doing some real good work in our community. And so I'm a fan of the program now, so anything I think we should increase it, but make it evidence-based to follow along with this model.
And one thing I'll say to that point is the act of community-led programs in of itself is an evidence-based strategy to build community capacity. So I wouldn't want anyone to walk away thinking that in of itself that's not an evidence-based model. It's just the rigorous evaluation that is required for evidence basis it's more stringent, and that's probably not appropriate for all of the work that we do.
Right.
But there may be some other things that we can do to measure impact more strategically.
Yeah.
And I don't think the vision is to say if something can't be measured that we would necessarily just throw it out. But I think that there are undoubtedly people who have been part of these programs or had city support that maybe we haven't asked them for the data or the information that they might be gathering or they might be capable of gathering if we ask for it. So
I agree with you, Mr. Chair.
Did you have something else? And I've got Mr. Winston, Ms. Iceland, Ms. Ashmere.
No, sir, Chair. That's all I have.
So this was the comment that I was never mind on before. I have concerns about moving this idea of the Jumpstart micro grant into this type of language, because my understanding was that this grew out of September 2016 and recognizing that there are things that are going on in parts of our neighborhoods, and this was you often heard the finger pointing, well, why aren't you doing more in your neighborhoods? And the response from the community was, there are plenty of folks that are doing good stuff in the neighborhood, but we don't get support. We don't get institutional support because we don't have those evidence-based type approaches to things. Well, we're not a traditional 501c3. We don't have this organizational and institutional knowledge to get the resources. And now, all of a sudden, we're flipping it and saying, well, we want to, that might have been good to say that we were going to do a year or 2 years ago, but we're going to back up from this, and then we're going to go away from those community members that are not going to fit these certain criteria to get the institutional support, and we're going to kind of go back to the stuff that we can prove and get traditional grants from, and we're going to rely on that. I think that's dangerous, and I think that is potentially getting us further away from these community members that we say that we want to interact with and support and bring with us on the trip to fix these problems. So I would caution us from talking like this.
And I hope that the conversation has not been or will not be about pulling back from what we're doing, but more so, can we expand it? And if we expand it, to the mayor's point and to yours, maybe that's a whole different thing. Or we could expand it within the framework of the program, the Jumpstart grants and things we're already doing, or maybe it has its own name and its own methodology. But I don't think that this is let's do this instead of what we've been doing.
Right.
Let the record show Braxton and I agree. I'm going to kiss him soon.
Hell hath frozen over.
Oh, yeah.
And if I can just say one thing just to make sure I clarify. So the intent wasn't to limit the capacity of the micro grants in this bullet, and maybe it shouldn't be in this at all, but the point was to say, build off of this model, build off of this work, and what we've learned from that is that supporting grassroots groups is extremely beneficial, and supporting them plus providing capacity building, which is the other piece. Thank you, Chief, for reminding me that. That it's really good to have the chief in your corner. I will take that every day of the week. Is a critical component. So whether it's with that program or others, how do we layer those types of things into what we're discussing here?
Ms. Eisel, Ms. Ashmary, Ms. Watley.
Well, you kind of hit on it. So we started this program before the protests, actually, before 2016. We were working on it when that happened because we recognized, and Chief had said then, look, I've got all these groups that I go to for help. And then I say, hey, we need your help when things happen in the city. And they're saying, well, when are you going to help us? And that's really what the program was built on, was saying, you're absolutely right. You're asking for help in the times of the rest of the year when you're doing what you do in the neighborhoods every day, and you need help building capacity. So that first phase of the program was always meant to say, we're not asking for data or outcomes. Show us a receipt for the pizza parties that you're hosting or whatever it is, the backpack drives. And we recognize that we need to help you. We'll have trainings to help you build capacity. How do you write a grant? How do you connect with other groups that are doing this work? So I definitely think there has to be a recognition of a two-pronged approach or three-pronged. And then the next phase was saying sort of where are the, we called them tall poppies at the time, that said, hey, this group's a little further along, and they could possibly apply for a different grant to do some of the work we really need them to do around community engagement initiatives without saying we're going to forget about why we started this.
Ms. Mara?
Thank you, Mr. Chairman. So as we are expanding into a more evidence-based approach, we also have to keep in mind that not all the programs are going to, we will have some sort of metrics, because there are times where it will take 2 years, 5 years, 10 years to really assess the success of any program from how it helps us reduce the violence. So if you're going into that rigid model, I just don't know if it will be fair to assess certain programs on evidence-based approach. However, I do feel that there is a need to some way to measure whether we are investing into right programs. So there's got to be some sort of middle ground where we are looking at not just rigid structure, but some sort of judgment that we'll have to leverage from our police chief and folks who work in the community to figure out there might be programs that may not be able to provide us data, but has our experts feel like it is moving needle in the right direction.
Ms. Watlington?
I just wanted to point out, and I know that we haven't gotten deep into the different department-specific objectives, but I want to make sure that we start the work with the end in mind, that when you talk about, and Councilmember Mitchell has said this before, the best prevention in violence is a job, or something to that effect, right? So I want to make sure that we're thinking about how do we incent, or how do we build capacity for folks. When people come and say a violence prevention initiative we have here is getting folks training on STEM education or IT so they can get hired, that we view that within a lens of this is a violence prevention tool.
And I think to some extent, Dave, and maybe we can grow it, but even here in the vision, the city, county partners, and community work together to reduce violence, increase economic opportunity, to build healthier and more resilient communities. So I think that is part of the, and I feel like it's somewhere else in here too, but I think that's definitely part of having proactive in addition to reactive solutions for this.
It's on page 3, leverage economic development, human services, workforce development to support economic mobility.
Yes.
So again, if this is something that, with some of the feedback we've given staff, we're comfortable with we can take a vote on it today. If you feel like there's more work needed, then we can certainly do that later. The mayor's charge to us was to try to bring this framework to the full council within 60 days, which we would meet that charge if we were to vote it out today. I personally, looking at this before our meeting today, feel like it does reflect the conversation we had last month. I think based on the feedback today, there's a couple of things maybe we want to highlight a little bit more. I think some of those minor changes, if there's something that you feel strongly about that we want to see a little bit more language around in here, I would say let's suggest that now. I think we can trust that this can be sent to council and a few small tweaks can be made. I don't think those should prevent us from moving it forward today unless somebody sees a big gap or a big red flag in there.
Move to approve.
Second.
Any other discussion? Is there anything in terms of the suggestions or the feedback you've given today that you want to make sure that they capture in a slightly edited version that comes to council? Or
I think.
is that Mayor?
Thank you. I see you were taking notes, but I think from the higher level perspective, we are moving forward in the right direction. Certain minor changes can be made before it's brought to the full council, but I don't think we should just defer this just for minor tweaks. That's just my opinion.
I agree.
So I guess when would it be in front of full council? In
That
a
would
week
be
or 2
the
weeks?
mayor's prerogative, but I would imagine probably sometime in February.
It's not my prerogative. It's when you get the work done. Your prerogative.
If you send it out today, then it's
Maybe
your
2 weeks.
it's your prerogative when it goes on the council agenda.
No.
Or the manager. You and the manager set the.
Okay, all right.
So I guess in
Unless I've misunderstood how all of this works.
I think that Ms. Edgemere is correct. I mean, you've got some tweaks to make. I do think that we ought to be very careful, though, on the idea of do community engagement that includes active participation and co-creation of goals and action items. I think that's a really big statement that commits us to doing things differently. So I look forward to the committee determining what that is. You don't get away with just coming and doing the framework. You know that, right?
do the work.
Yes, Mr. Mitchell.
I'm out in favor of going forward, and I agree with Mr. Chairman. I do think there need to be some tweaks. So one entity I left out, and I give Councilman Winston credit for this, is the internal government collaboration. Somehow we got to include the DA office. I mean, we're really talking about collaboration and crime. Let's make sure every entity is part of our conversation, part of the solution. So.
And I know they've been part of that work group that Dr. Harris spoke about, but I think moving forward, we've got to, at some point, and I don't mean we have to decide as in we will be the only ones who have a say in this, but I think we've got, collectively, we have to make sure that all of the right people are part of that working group, and if there are additions or subtractions or that we've got the right group going forward. And to the conversation earlier about, I think Dr. Harris kind of was on the same wavelength as I was, which is if the leader of that group is someone from the city or someone from the county or someone from one of these entities specifically, maybe they come in with a little bit of a, I don't want to use the word bias, but I can't think of another word, and a little bit of that mindset. So maybe at some point we need to consider, is it somebody who is not directly coming from one of those entities, and maybe it's a shared resource and a shared cost between all of the partners in this work to identify someone who can be the independent head of this effort. Mr. Winston?
Just to Mr. Mitchell's point, and something I've already sent to the chair, if the DA is going to be at the table, I think the public defender has to be at the table, because the DA is the lawyer for the state and the lawyer for the victim. But if we want to deal with violent crime and those that are perpetrating, we should talk to the person that's representing those folks that are accused of those crimes, and those are the ones that have seen and can prescribe data and perhaps remedies for dealing with the holistic person who is being accused of this. we have to look at the person-centric and not simply what we as the state or organization wants to deal with.
Mr. Rashford?
Yep, and actually, thank you all for the conversation regarding the involvement of all of these entities. As staff was working on this for the past several weeks, one of the things that we spend a lot of time talking about is city and county collaboration. We said that we see this entire process as a call for all local governments to take ownership and responsibility for the issue of community violence and to develop and implement a comprehensive plan to address it. And this includes city, county, CMS, the sheriff's office, judges, the district attorney's office, towns in Mecklenburg County, state and federal, local, state, and federally elected officials should be working together to address this problem as well as their respective staffs. So as we're looking at this thing, especially as we thought about the involvement of the city and the county, we see the community of Charlotte-Mecklenburg as a big ship out in the middle of the ocean. And while this ship is carrying us, the residents, forward, a hole develops in the back of the ship and one develops in the front of the ship.
A morbid analogy.
And Larkin Eggleston is the captain of the ship, so he dispatches the county to fix the hole in the back. He dispatches the city to fix the hole in the front. And the city does a great job fixing its hole. The front part of the ship is not taking on any more water. But the city can't sit back and realize that the county may be struggling preventing water from coming on the ship and say, well, we've done our part. Right. So if this ship that's going to deal with community violence is going to work, it is absolutely crucial that both the city and the county take the lead in coming together to do this work. And this means city council members and members of the county commission sitting down face to face at least once a quarter to sit down and talk about this thing. This is not about egos. It's not about position or what is the predominant government in this community. It is about saving the community. So you guys got to come together.
Two requests. One, to Mr. Winston's point, if we can make sure that almost exhaustive list that you just rattled off includes the public defender's office. And two, our request that there be no more analogies of our local government being like
Are we not receiving a suggested policy change by our staff that we should consider right there? That we have local collaborative meetings, that we have some type of regular
I think that's in here.
consolidated
Yeah.
action and work?
I think that's outlined in the presentation.
But that's something specific that's been taken out of
Yeah,
this.
we got it.
This has been something that's taken out of that.
But that's what we're approving in a
Yeah,
framework
it's on
right
page
now.
3 under long-term, yeah.
That is something that's specific.
I don't know that that's a policy, but we should do it. The question I have is, to what end? And this is where we always get into it. We're going to have the meeting, there's an agenda, but there are no rules or norms or focus without real agenda items to talk about. So I like the staff to think about, yeah, sure, meeting is great, but I found effective meetings are what drives change. And so who's going to facilitate those meetings? Who's going to make sure that they get calendared? Who's going to make sure the agenda has content to work on? And those are the things that will make a difference, because you go to the first meeting and it's not effective, you don't show up again. Yes.
But we don't have an option to do that, not show up again until this is solved.
Well, that's what happens. It happens a lot when people choose options. So I think what I'm saying is, if it's in the framework, I see this framework as needing lots of action to be done. And I'm hoping that we kind of parse it out and start thinking, well, who's going to do the model for engagement? And that's a city and a county function. It can't be done that we're going to have our own engagement model.
Well, I think some of, and Ms. Charles or Ms. Hazel or Ms. Hefner jump in, I think some of the, and it's possible that there was intent in the charge that we didn't receive properly, but I think this was to help kind of set the course for the action, not necessarily to prescribe what the action is yet. And so this, I think, will guide staffs working with the manager to identify what's going to go into the budget. It will guide staffs working on what sort of policy opportunities and policy changes, program implementation, things like that to bring back to us.
Right.
I don't think this was built with the idea that the action is prescribed by it, but is guided by it. If that makes sense. And again, if that's
No, the framework should guide the action.
Right.
Yeah.
Oh, it sounded like you were saying that you thought there should be more action outlined in
No,
here.
I'm saying get the framework and then decide what actions are and who needs to meet with them and how they work. So that would be the next charge.
Yeah. So we have a motion and a second on approving the framework with the small edits that have been suggested by the committee and other council members. Is there any other discussion or input to guide staff in making those amendments? If not, then all in favor of approving the framework with those edits, say aye.
Aye.
All opposed? Thank you, everybody, but particularly Ms. Hazel, Ms. Hefner, Ms. Charles, Mr. Ashford, and Dr. Harris for all the work on this and the presentations. Given the adoption of the framework there, Ms. Charles, is it probably not as critical that the next committee meeting be prior to that March budget workshop?
Sure, not
So-
unless you think the committee needs to talk about anything related to the budget
So
workshop.
I think in deference to Councilmember Mitchell and Councilmember Ajmera's first week of March, maybe we go 2 days after the primary.
Okay.
I appreciate you. Would Thursday, March 5th at noon work for all or the majority of the?
Yes, thank you.
I figured, we talked about Monday or Thursday. I figure y'all might be a little busy Monday too.
March 4th is the budget meeting.
Yes.
So and the 4th before the budget meeting is fine with me.
Well, I was trying not to make people's Wednesday too long, but I'm happy to do that if Wednesday works better.
Hours. The budget workshop.
I know, she was saying we could do it right before the budget workshop,
the
which
bud- yeah.
is certainly an option if.
Say communities is on now.
Right?
Yeah.
We'll do it before.
I'm good for either. So noon on the 4th and noon on the 5th, committee.
Noon on the 4th would be better.
You're not going to be
this-
sleeping until like 2 p.m. that day?
No, because the budget workshop, there are times it goes on till 5 or 5:30, and we've
yeah.
seen that in the past, where budget workshop could go until 6, so we don't know.
Well, that's why I was saying I didn't know if you wanted to add another meeting to that day. But I'm good with Wednesday or Thursday, so.
Wednesday's good.
You're gone? Okay. Wednesday. All right, we'll do Wednesday the 4th. We're already here, so.
Okay.
Wednesday the 4th at noon.
I ain't mad at you. Wednesday noon?
Wednesday the 4th at noon, yes, sir.
Got you. Just a bit of information, I can, Mr. Chairman.
Yes, sir.
Committee, if you could just information on it, because we got new council members. Can you just send us all those who have received a micro grant, just so everyone's kind of familiar and those organizations? I think that'd be helpful information.
That's the micro grant recipients.
Yes.
Okay.
Okay.
Hey, can we get emails with all the presentations from today as well?
Sure.
So, unless anybody has any other business, I will happily accept a motion to adjourn.
So move, Mr. Chair.
Second.
All in favor?
Aye.
Aye.
Trains run on time, 1:28.
Yeah.
That's